And the recording is in progress. That means we are starting now the session. So warm welcome from my side. My name is Priska Fleischin. I have the pleasure to represent the International Federation of Social Workers in a function of representing IFSW to the United Nations with a wonderful team. Among us is Annalisa. She helped a lot to start this CPD. We haven't done that together. We have had colleagues, marvelous colleagues at the side of OHCHR. So we co-established this second edition of this CPD. The idea of having a second edition was quite clear after the first edition last year that we found it so successful, so meaningful that OHCHR and IFSW share their understanding and bring together a global and local perspective on social work as a human rights profession. We are having 4 sessions in total, and we want to focus on care and support systems based on a care economy approach from ILO. Today we're going to have a kind of a understanding from different UN agencies and IFSW. Later we'll focus more on several aspects of this concept, going on care and support receiving understanding, caregiving understanding, strengthening social workers, you, dear colleagues, in your understanding of this approach, which is brand new. And then at the end, also having with the 4th session more a global and more political and session. So to really round up and give you also some ideas on how you can advocate as social worker on a national level. We as IFSW often prepare policy papers, so at the end of this course in our UN Commission, we're going to discuss whether we want to create a policy paper that could be guiding for social workers in this theme on how they can work with this care and support understanding globally. And every policy paper has to go to the general meeting, which is next year in Nairobi. So this is somehow the follow-up of this discourse. And I wonder maybe on OHCHR side, so we will have more collaboration and things that come up after this course, maybe some more collaboration with WHO and ILO, we'll see, but we just let it start and grow with this course. So this as an introduction from my side. I now have the pleasure to pass the word over to Pradeep Wegal. We know each other from last year's edition. Thanks to your okay of having this collaboration with your team. We have now this opportunity of running this course. Pradeep, can you give our colleagues a little bit of insight from your side? The microphone.
Thank you so much, Priska. Dear colleagues, it's a pleasure to be here. It's, I would say, both honor and pleasure, and also pleasure to be one of the key partner of the global work that that you all do on social service. It is also honor to be part of this because it's very important topic that we are discussing, which is care and support system for social workers. The key question, and of course, is one of the key global issue as we stand today, which is how can we create, sustain, and transform care and support systems that are grounded on human rights norms and standards that respect the human dignity, autonomy, and rights of all individuals, especially the most marginalized in our society. Care and support, including childcare, support to persons with disability and older persons, that domestic work and self-care are fundamental to the well-being and prosperity of individuals, societies, and ecosystems. Without it, our society would stop functioning. Everyone requires care and support in their family, in their lifetime, in their life course. Care and support system are fundamental to all persons in their diversity to participate equally in society and enjoy the full range of human rights. However, the system we rely on today are not sustainable. Current care and support systems across the world are built on deeply profound inequalities and often deny people's autonomy, agency, and dignity, particularly those who are already marginalized, both as those providing and requiring care and support. As we can see around the globe, it is predominantly women and girls, including those with disability and older women, who shoulder the share of unpaid and underpaid care and support work. Women spend on average 2.5 more hours per day than men on unpaid care and domestic work. This deprives women and girls of time and opportunities for education, gainful work, participation in public and social life, and for their self-care and personal development. Women, including women migrant workers, dominate lower ladder of paid care and support work, working in precarious and unsafe conditions with very low wage. Conventional care and support systems often prioritize and normalize placing those requiring care and support in care institutions rather than prioritizing their life in community. The current system tend to disregard dignity, autonomy, choice, and agency of those requiring care and support, be it children, person with disability, older persons, or person with long-term illness. The path towards demands The path forward demands a radical overhaul of those outdated and unjust system that we live in. It is essential to break the false perception that certain people, such as women, are only caregivers, while others, such as children, persons with disability, and older persons, are merely dependents of care and support. In reality, every one of us, at one point in our lives, or even simultaneously, provide or need care and support. This is an inherent part of our humanity and something we must embrace in our systems and policies. Human rights articulated by international human rights norms and standards, including international labor rights standards, can guide the transformation of care and support economy and systems to overcome these challenges and to make such system gender responsive, disability inclusive, and age sensitive, with full respect of international human rights norms and standards. International human rights norms and standards can also provide guidance on identifying what are the human rights of all people concerned in care and support system, and how to protect their rights, namely the rights of people requiring care and support, people providing unpaid care and support, people who are care and support workers, including those who are migrant workers and social workers themselves. Throughout this workshop, I trust that experts will be unpacking details of these rights and their implications. Social workers play an essential role in the transformation of care and support systems. You are the agents of change. You are at the forefront of this transformation, advocating for policies that prioritize human rights and shaping care and support systems that work for everyone. You hold the power to challenge the existing stereotypes and discrimination. You can push for stronger right-based laws, policies, and services. Social workers also must actively engage in dialogues and policy discussion on care and support. As you engage with both those providing and requiring care and support, you are very well placed to advocate that systems uphold human rights norms and standards of those who you serve and of yourself. The, the UN High Commissioner for Human Rights has stated that we need to join forces to support this transformation. Strengthening care and support system require the cooperation of all stakeholders. We need to work with, first and foremost, with the right holders in all their diversity and their representative organizations, and also with governments, business, communities, and families. This is a collective call to action urging all of us to work together to create sustainable and right-based care and support system. Thank you all for being here today and for your vital work that you have been implementing every day to advance care and support systems. I wish you a very fruitful discussion, and our office stands ready to continue working with all of you, and I wish you all the best.
Thank you so much, Brady. It's wonderful to see the interest of you and OHCHR in collaborating with the social workers. Thank you so much. And with that, we pass the word to Joachim Mumba, the President of the International Federation of Social Workers. You have two options today. One is the welcoming word, and later you will share a bit more about your work. But first, I'll pass it to you, representing IFSW and welcoming. Thank you.
Thank you so much, Priska. And is it good afternoon, good morning? For some, probably it could be in the evenings. So distinguished colleagues, esteemed organizers and participants here present, I wish you warm greetings from IFSW. So it is a privilege to be with you today as we embark on this essential journey of professional development focusing on care and support systems. I extend my heartfelt gratitude to the organizers, of course, including Priska, our own, the Office of the United Nations High Commissioner for Human Rights, for your dedication to strengthen the social work practice worldwide. In Africa, we say umuntu, ngumuntu, ngabantu, a well-known proverb from the Nguni languages, meaning a person is a person through other people. This philosophy, rooted in Ubuntu, reminds us that our well-being is interconnected and that care and support are not just professional responsibilities, but fundamental values that sustain our communities. Colleagues, care and support systems are the backbone of our societies. They safeguard dignity, promote autonomy, and uphold human rights principles that define our profession as social workers. As our world faces profound demographic shifts, widening inequalities, and complex crises, the urgency of building inclusive, sustainable, and rights-based care frameworks has never been greater. Encouragingly, the global recognition of care and support as a cornerstone of societal well-being is growing. International institutions, including the United Nations, are increasingly prioritizing policies that address both the needs of care recipients and the rights of caregivers. Yet, as social workers, we are not merely participants in these conversations. We are actually key actors. We advocate, implement, and innovate to ensure that care systems are equitable, accessible, and responsive to the diverse needs. This course presents a valuable opportunity to deepen our understanding, share best practices, and collectively strengthen the role of social work in care provision. Through our engagement, we contribute to shaping policies and interventions that uphold social justice, empower communities, and ensure that no one is left behind. As we embark on these discussions, let us reaffirm our commitment to a future where care and support systems are recognized as a public good, where caregivers are valued, and where every individual receives the dignity and support they deserve. Let us carry forward the spirit of Ubuntu, knowing that by lifting others, we are actually lifting ourselves. So I look forward to the enriching exchanges ahead and to the collective impact we will continue to make in advancing human rights and social justice. So I thank you all.
Thank you so much, Joachim, for your welcoming speech. And I should share with the colleagues that your background is the social work theme that we have and celebrate this year, which is also a bit linked to this topic, strengthening intergenerational solidarity for well-being. So thank you so much for this, and I'm happy to hear more from you a bit later. So as we speak about care and economy, care and support system, and that goes back to care economy, Laura, who is representing ILO here for us, I think you are the person that can best possible explain what is behind this care and support system. What is this care economy about? So I'd like to pass the word to you and give you this 10 minutes that we have for each speaker. And if you go much longer than that, I'll give you a sign. Okay.
Thank you very much, Priska. Good morning, good afternoon, dear participants, and thank you so much to the International Federation of Social Workers for having the International Labour Organization today. I'm really feel enormously privileged to speak to such a broad audience of care workers. You are really the backbone of this care and support systems that we as a UN agency, and I'm very pleased to be here with the OHCHR colleagues and WHO, really trying to strive to serve really this philosophy of Ubuntu that our president has shared with us, and how we have tried to do this. We try to promote this agenda of advancing decent work in the care economy from an ILO perspective, because we are a tripartite specialized agency in the UN system where governments, but also employers and workers representatives come together to adopt convention, recommendations, frameworks, codes of conduct, etc., that try to promote the improvement of our daily lives, our working lives, and to promote social justice. So in the theme of the care economy, we came together, and I'm going to share a couple of slides that I hope can help convey the messages that I would like to share today. We came together last June and adopted a resolution on this topic, on decent work and the care economy, that it's the first international tripartite agreement on this topic. The ILO has many international conventions, the recommendation, which are treaties. This is a resolution, is an agreement that's aimed at basically set a context. We have to respond to a number of challenges, and we will touch upon this, but also we wanted to promote a common understanding on this topic that is increasingly high in the agenda, but also raises questions, what we're talking about and how we should go about it. And this recommendation, this resolution try to guide, brought together a consensus among governments, employers and workers on how we should, what we should do to advance decent work in the care economy. I think this is very important to the work you're doing, because it's through this increased understanding of the approach of advancing decent work on the care economy that we can improve not only the lives of those who need care and support, but also to improve and uplift the lives of those that provide care and support. So this is comes to the resolution sets a context, recognizes that care is central to human, social, economic, but also environmental well-being and sustainable development, and that care work, both the paid and unpaid part of it, is essential to all other work. But it was built on a recognition that there are significant gaps in the context of a changing world, and gaps for, in particular, paid care workers. And here I would like just to you to leave with a couple of striking figures. When we talk about you as social and care workers, we're talking about a broad millions of workers around the world. In total, we estimated in 2018 that there are 380 million, and of those, 130 million are health and social workers. So you're part of these enormous millions of women and men, but especially so these represent, almost 4% of global employment. So you are an enormous weight in the employment, the global employment. So you have a voice and an importance that these figures recognize. We also know that 2 out of 3 of you are women. And this is extremely important. So that speaks to the gender dimension of this workforce. And also we're working to collect more data so we can tell more about, other characteristics of this workforce. So over 90 million women. What else do we know about that? This represents, 7% of all employed women that work in health and social work sector. So this is really vis-a-vis only 2% of all employed men. So this is again to reinforce the gender dimension. But another aspect that is very important is the working conditions and pay of these social health and social workers, because many are in non-standard forms of employment. They're working temporary, part-time, agency work with decent work deficits, job insecurity, low pay, lack of access to social protection, so being the informal economy, lacking voice and representation, the right to organize and collective bargaining, and also being subject to violence and harassment. In these conditions, we are very aware, and this resolution recognizes that these situation matter, because this not only affect your well-being, your working condition, and you have a right to that, but also that this affects the quality of care, and we cannot have quality care and support for those who need care if there are issues related to, staffing levels, stability, and training. And my colleagues will speak more about this. And this graph really shows, the gaps, the pay gaps that are especially, for instance, marked to personal care workers, that the green bar in health services. So you consistently certain category of social and health workers are paid less. And also we know that the gender pay gap, the difference between women and men, the pay differences are higher in this sector compared to the general one. So important issues that are recognized, that of course we like to have more data, but are very clear, and this resolution calls to urgent action to tackle that. And another aspect that the resolution deals with is creating this common understanding of the care economy. So what is the care economy? What are we talking about? So we're talking about both the work, the care work, that is activities and relations that are essential to promote the well-being and to maintain the sustainability of life for a number of persons who need care support, children, adolescents, youth, adults, older persons, persons with disability, racialized groups, and also those who provide, unpaid care directly. We're talking about also care work that is remunerated and non-remunerated, and work that is care, that is direct, that involves, a relational contact and activities with the person that needs care or support, but also all the indirect care work that makes the care possible, not this Ubuntu possible. So it's the two dimensions. And also we're talking about, of course, the care workers in education, early childhood care and education, health and social workers, domestic workers, and also those that perform unpaid care work in also for of course in for instance as volunteers that can in the community or for third parties. Also there is a recognition that the current social organization of care generates inequality and social exclusion. And when we talk about which is also the president has highlighted, then when we talk about the actors and those that are involved, we're talking about public, private, not-profit sector, but also actors of the social and the solidarity economy and households. So when we talk about the care economy, it puts together all these actors, but also the policies and the regulatory frameworks, the services, the infrastructure, the financial mechanism, but also the social norm, the influence in government, the provision and the receipt of care and support throughout the life course. So just the third part of the resolution talks about the guiding principles, and these are guiding principles that have been reaffirmed in a number of international frameworks that also now are become common for the UN system, and reiterate the principle that, for instance, labor in the care economy is not a commodity, building on the Declaration of Philadelphia, and all people should be able to provide and receive care, including self-care, that all care workers should enjoy decent work. And these are really the principles of a rights-based approach to care and support that also build on the ratification and implementation of fundamental convention and international labor standards relevant to the care economy. These, as we heard, also essential to this rights-based approach to care. And maybe also for time concerns, I would like to highlight the importance of a number of other principles that are the principles of non-discrimination, solidarity, sustainability, equity, universality, social co-responsibility, community-based, the primary responsibility of the state, and also this whole of government approach. Of course, a number of other principles are part also of the resolution that calls for building integrated and coherent strategies for decent work in the care economy that are grounded on those international labor standards, on social dialogue, and build on a framework, the 5R framework for decent care work that is now the UN framework for delivering quality care work and ensuring that care work is, if you look at the right side of the figure, that care work is recognized, redistributed, reduced when it involves drudgery, that care workers are rewarded by promoting more and decent care work, and care workers, those that provide care, unpaid care, and receivers also are represented and have a voice, to shape their rights and moreover all this the care system. So this is an important framework that you might hear over and over in the narrative and the discourse around the care economy. And so this is very important because it's an approach, a roadmap for advancing a rights-based approach to care. The resolution also recognizes the importance of investing in the care economy, which can lead to social and economic development. And we have important also research that we have carried out about the impact in terms of job generation, in terms of reducing gender inequality, and improving also employment outcomes for women. And also that there is really, I would say, a win-win in terms of every dollar invested, there is also a kind of return, because these are really investment and not expenditures. So the resolution closes with a number of recommendations that I've tried to synthesize in this visual slide that touches upon really virtually every aspect of the care economy, keeping in mind, this importance of creating these comprehensive care and support systems, and that are, of course, gender responsive, and there are that are rights, human rights based, and my colleague Asako will speak to that more. But they try to analyze, speak to the importance of developing social protection benefits, maternity protection, active labor market policies, fighting discrimination, addressing the undervaluation of care work, building the skills and the working conditions and the voice and representation of care workers. So just in a nutshell, to talk about really the areas where the resolution really call for urgent action. So we're all active, to really mobilize constituents to act upon this. And like just before the conclusion, the ILO, and I know I'm as prioritize a plan of action that will guide our actions, so to give effect to this resolution. And we're planning to launch a platform that will promote sharing of experiences and building capacity. So this is open to care workers, to social workers. We really open and want to see more of the collaboration also with you, with your organization. There will be a tripartite meeting of experts on paternity and parental protection to assess if there are gaps in international labor standards. And also the ILO will work towards creating statistical standards on care work to improve the measurement and, of course, the action on this topic. So I'd like to thank you for this opportunity to share the ILO perspective. Care work is real work. We really want to work with you to value it and value those who care. Thank you very much.
Thank you, Laura, so much. The ILO presentation is a key presentation here because it's, as you mentioned, a foundation for this whole development. And you mentioned OHCHR and Asako, who can now share with us the more human rights perspective on care and support system. Thank you, Asako.
Thank you, Priska. Am I making myself heard? Yeah.
Yes.
Okay. And hello, everyone. Today, I'm very happy to share the key findings of our office recent report on human rights dimension of care and support. That kind of illustrated what kind of human rights standards are relevant to care and support systems. And the report is based on a wide consultation with rights holders, like rights holders and the states, UN agencies like ILO and WHO joining here, but many more others, and then experts, including women's rights organizations, organization of persons with disabilities, organizations working on the rights of older persons, children and youth, and then the workers and then employers organizations too. The report also builds on earlier guidance developed, including the UN system-wide policy paper on transformation of care systems and the International Labour Conference just a resolution that Laura just presented. Okay, up. So, first of all, let me explain the concept of care and support. There is no universally agreed definition of care or support applicable to all population. Therefore, in our report, we use the working definition of care and support as acts of assisting others to carry out daily activities, maintain well-being, and participate in society with dignity and autonomy, and then also caring for oneself, in other words, self-care. Typically, care and support work consists of paid or unpaid work, as Laura mentioned, including childcare, support for persons with disabilities and older persons, and domestic work, such as cooking and cleaning. It can be undertaken within or outside of the household. Here, let me explain why I have been referring to care and support, and then not only care. The concept of care and the current mainstream discussion on care is understood mostly as unpaid and paid care work. Discussion of care often focuses on rights of violations and the inequalities faced by those providing care, who are mostly women and girls. Also, the Convention of the Rights of the Child, UN Human Rights Treaty, talking about child rights, provides for the rights of the child to protection and care. The concept of care may also include the work done for the care for the planet, the work done for protecting the environment and climate. The human rights concept of support has been developed under the Convention of the Rights of Persons with Disabilities, that is a treaty talking about rights of persons with disabilities, and that it places emphasis on autonomy and agency of those requiring assistance, and they reject paternalistic forms of care they had to be subjected to for a long time. So support can be provided not only by human support, like personal assistance, but also by assistive devices, technologies, and infrastructure. Some types of support work may not be usually considered as care work, such as professional sign language interpreters. So while care and support have distinct elements, both concepts emphasizes the rights, dignity, autonomy, and the agencies of individuals concerned, either as those providing care and support or those requiring them, and their equal participation in the society. Both concepts consider care or support as a basis of enjoyment of human rights as part of humanity and the sustainable function of the society. To capture both concepts and to apply all relevant human rights standards, we refer to care and support. So, what kind of human rights are relevant to care and support? The report analyzes existing international human rights standards, including international labor standards, as Laura mentioned, by 3 dimensions of care and support. They are the rights of those providing care and support, the rights of those requiring care and support, and the rights of everyone to self-care. And then the study also identified general principles of human rights applicable to across all the 3 dimensions. It is important to note that the rights of those providing and requiring care and support are intrinsically connected. On one hand, if the rights of unpaid caregivers or paid care and support workers are not protected, those requiring care and support will not be able to access sustainable and quality care and support they need. On the other hand, if the rights of those requiring care and support are not protected, the system would fail its very purpose of caring for and supporting people. In the worst case, so-called care in the conventional care model provided could impose inhuman or life-threatening treatment on those receiving them. We should also recognize that the one person may be providing and requiring care and support at the same time. For example, parents with disabilities may require assistive devices or human support, and then with that support, they might provide care for their children. Parenting adolescents or children caring for their parents or grandparents need care and support. The children caring for their parents or grandparents who might need care and support still need protection and care for themselves as children. So the one person might be providing and requiring care and support at the same time. Therefore, our analysis is based on the notion of interlinkages of the rights of those providing and requiring care and support. So now I will go into the little bit of details of those three-dimensional and general principles on care and support. But please note that in my presentation, the rights and principle mentioned may not be exhaustive, and my explanation may be simplified to make it easier to understand. So if you wish to know more legally accurate description of them, please refer to the report. So what are general principles applicable to all three dimensions of care and support? Those include non-discrimination and equality, dignity and autonomy, participation in decision-making, freedom from violence, states' responsibilities in mobilizing and distributing resources for the realization of human rights responsibility of business enterprises applicable to public and private service providers, and then access to justice and remedies. So those are relevant to both those providing and requiring care and support. Talking about the rights of those providing and care and support, as Laura's presentation mentioned, that the rights to decent work and social security would be crucial for those working as care and support workers, including migrant workers. Currently, 7 million children are working as domestic workers, many of them girls. Therefore, prohibition of child labor is also relevant. For those providing unpaid care and support, their enjoyment of rights to social security, adequate housing, food, and the productive and financial resources such as land, credit, and property are often important bases for themselves for providing care and support to others. Workloads for unpaid care and support and the social norms around unpaid care and support should not undermine the enjoyment by those providing care and support of their own human rights, such as rights to health, education, and work. The people who are providing care and support, unpaid care and support, should be able to enjoy rights to health, education, and work equally as others. The elimination of gender stereotypes and the realization of equality in the family and marriage, including the common responsibility of both parents for child rearing, are important to ensure the equal distribution of care and support between women and men. Stereotypes against persons with disabilities, children, youth, and older persons that perceive them only as recipients of care should be altered, and their role as caregivers should be recognized. Likewise, stereotypes based on race or ethnicity, indigenous or minority status, or economic status that may perceive certain people less capable of providing care and support should be eliminated. Then, what are the rights relevant to those requiring care and support? Freedom from an institutionalized setting of care is one of the key rights, such as for persons with disability, children deprived of family environment, or older persons and then others who require long-term care and support. Here, institutionalized setting of care means depriving personal choice and an autonomy of persons in care setting as a result of the imposition of life and living arrangement characterized by certain defining elements. Such forms of care typically happen in large residential care institutions, but could also happen at home. Sorry, I have to go back. Sorry. In this regard, the right to live independently and included in the community is crucial for persons with disabilities of all ages, including a right to choose services and service providers according to their individual requirements and personal preferences. Children should have their right to life, survival, and development, and to protection and care be protected in care and support settings. Likewise, their right to be heard and then have their best interest taken as a primary consideration in all actions concerning them must be protected too. Right to privacy, legal capacity, health, education, social security, equality in marriage, or accessibility, including accessible housing and infrastructure, are important for those who are in need of care and support, not only in accessing necessary services, but also in improving and maintaining their autonomous life. Stereotypes and stigma that perceive those requiring care and support as passive dependents without agency or as burden of the society must be eliminated. As for the rights relevant to self-care, at the global level, the human rights concept of self-care need further elaboration. For example, WHO has worked a lot on the concept of self-care in health settings, but the more general, broader concept of self-care in terms of human rights need further elaboration. The report identified following possible rights relevant to self-care. Those include right to rest, leisure, and play, and to cultural life. Rights to decent work, for example, in relation to life-work balance. Right to accessibility for persons with disabilities. Right to health, including sexual and reproductive health and rights. Right to privacy and confidentiality. Freedom of association, expression, including freedom to seek, receive, and then impart information. The last one may be particularly important for peer support among for example, among the person with disabilities or among the community to support each other. Lastly, let me share key recommendations the report has come up. Firstly, as I mentioned, it will be very important that all three dimensions of care and support and the both rights of those providing and requiring care and support should be addressed. And it would be very important to eliminate layers of inequalities and stereotypes based on gender, age, disability, migration, indigenous minority status, etc., has to be addressed. And then it will be also important to scale up investments in care and support economy, guided by human rights, instead of the imposing the competition between the rights of those providing and requiring care and support within the very limited resources. We don't need to make them zero-sum game among them. And lastly, to consider using the 5R framework, as Laura's presentation mentioned, to transform the care and support systems. As Laura mentioned, that is what UN as a system encourage all stakeholders to consider for the transformation of care and support. So laws and policies and measures applied in each country will require, depending on the local context and available resources. However, I hope that these human rights standards and policy options help shape the ways to advance rights-based care and support systems that work for everyone in each context. Thank you for listening.
Thank you so much, Asako. So I think with Laura and your presentation, we do have a really robust foundation of understanding the concept of the two organizations. If I can refer to some questions in the chat, they would really like to have the slides that you presented. And the easiest is if you just upload it in the chat, Laura and Asako. And besides that, if you can send it to me so we can have at the end a summary of all the presentation that we can send those who participated. Thank you so much. I now would like to hear from Asiya what happens at World Health Organization, because it's almost a year ago that we have met in Geneva, World Social Work Day, and you approached us and IFSW and said, hey, there's an interest in collaborating. We look on a new program on community work, and since then you have been working with Rory and the whole team. And so since then, we are also aware that WHO has an interest in a more focus on community work, and that is so related to social work. And it's a pleasure to have you with us, and I'll pass you the word, and we hope to learn the WHO approach. Thank you.
Thank you, Priska. And I remember when we first met, and I think you told me that I spoke like a social worker, so I was delighted by that. And actually, the field of social work reminds me of the origins of my professional life, which is in community development. So I also trained as a nurse and in public health. So the work that I'm engaged in now, which is looking at the relationship between service provision and those who use services and those who design and deliver services, is really important. It's that relationship that I've looked at. I have a long history with WHO. I have a lot to say about the way that we approach community and how we address community. So I think I just want to take this opportunity in the 10 minutes that I have to really offer some reflections on why community work is so important to WHO, but also to governments and their approach to healthcare systems, particularly given the current environment of increasing conflict, increasing disconnection. What's happening out there in the world is really impacting the ability of our systems to be able to deliver on everything that has already been spoken about, right from Pradeep to Joachim to Laura and Asako. And I think one of the fundamental pieces that we really need to understand is that, and I speak from having been born in Africa, having been raised in Europe, and also being married to an Eastern European, is that our worldviews and the culture in which we are born and educated in influences how we understand and experience community. And if you look at sort of the training that healthcare professionals receive, it's very much based on a Western model of identifying disease and treating disease. And if we look at how healthcare systems around the world, the relationship between healthcare and social care, we'll find that maybe in half of national healthcare systems, social care is part of healthcare. But in the other 50%, social care is in another ministry. So already, if there are two separate ministries, one focusing on delivering healthcare and one focused on delivering social care, you will not, collaboration between the two will be very, very difficult. So I think there's this focus on community and the relationship between service design and delivery, and making sure that people have the kinds of services that respond to their health needs across their life course, means that we have to look at the way that health systems engage with stakeholders, the way that the system itself has been designed to be able to engage. And WHO's work on community engagement has a long and rich history, right from Alma Ata in 1978. Primary healthcare talks a lot about participation and the right to participation and decision-making in one's own health, but also the responsibility of government to be able to deliver the right kind of services in the right way to people, including those who are most disadvantaged. I think the term community engagement really within WHO became important after the West Africa Ebola response in 2013-16, where we received a lot of criticism in that we were not integrating the social sciences into our emergency response work. And so there were a number of reports that we developed. There was a big focus on WHO's integration of the social sciences and the humanities. And this gave us the opportunity to look more upstream around service design and delivery and how engagement is being approached. COVID-19, the pandemic, again, another important lessons learned around the importance of meaningful engagement with many different types of stakeholders. But the pandemic just didn't also re-emphasize the importance of meaningful engagement. What it did do was it uncovered sort of the long-standing deep disconnect between health systems and the people that they're trying to serve. We recognize now that there's a growing mistrust in institutions. If you go on YouTube, you'll find a range of different information sources that appear authoritative. And so there are conflicting health advice, which people are also being exposed to. But also on the health and care workforce, we see that there's escalating burnout. We're losing staff. We're not getting enough new staff within health professionals. So we have a high turnover. We have social isolation and disconnection within the healthcare teams themselves. And so this is also affecting the relationship between health providers, health and care providers, and patients and their families and the wider communities. So we have frameworks like the WHO Global Health and Care Workers Compact. At the policy level, I think it's really easy to make sort of policy statements and say, this is important. We need to work on this. I think the difficulties is translating policies into meaningful action at all of the levels of healthcare delivery, and this is also across sectors as well. We had the fortune of having the IFSW input into a policy report on relationality in community engagement and what that means for humanizing healthcare, and make that available. And I think this policy report, which is for government, and I noticed in the messages, somebody commented that governments need to hear this. And I agree, governments need to hear about the connection between healthcare and social care. And the policy report is aimed at government, and it's actually saying to government, relationality has to be the foundational approach to the design and delivery of services across all sectors. And so the health and care workforce, which Laura gave figures on the substantive statistics around how many people are employed in the health and care sector, if those people are supported and given agency to be able to lead the kind of changes and transformation that they need to be able to do to shift the way that they do their work, that would take us a lot more forward in terms of having these big systems reorientated towards health and well-being. The issue is that we have systems right now that are orientated towards identifying disease and treating disease. We wait for people to get sick and then we treat those who are sick. So we have to find a way of integrating the social determinants of health within the current design and delivery of services. And this also means educating the health and care workforce around a holistic model of health and well-being. And yet we see that the training of physicians remains within sort of these specialized areas where the human body is seen as sort of body parts that need to be fixed. And I think one of the big things that we've needed to push is the overhaul of medical training, so that medical training is holistic, it's fit for purpose, and that our physicians are trained in more collaborative ways in a holistic approach to well-being. So we have a system that is built on a deficit model, that we need to change that. And I think this whole concept of community work and community engagement and the responsibility of government to engage through its service provision gives us an opportunity to really address some of these fundamental disconnects. And one of them is that community work is not just about delivering services. It's about how those services are delivered. It's about how people interact. It's how people form bonds. It's how people connect. It's about the belonging, the sense of belonging that is also cultivated within the healthcare teams that are designing and delivering services. And I think, yes, clinical care matters, but we need to go beyond clinical care and look at clinical care in the context of the health issues that people are facing. My sister is a senior midwife in a large hospital in the UK, and over the years of her professional practice, she's seen that giving birth now is more problematic because people have diabetes, women have diabetes, they have cardiovascular disease, they have health issues, metabolic illnesses that makes childbirth more problematic, which means that there's more pressure on the midwives to be able to deliver the kind of services. So childbirth itself has become more challenging, and this is in systems that are already challenged by some of the issues that we've already spoken about. I think community engagement as defined by WHO, and particularly the work that we've been doing in integrated health services, is really focused on relationality. That community engagement is about building and sustaining relationships of trust. And the policy report that we've introduced really talks about how governments need to build capacities and skills and approaches in relationality that enable people to be able to change how they do their work and how they're able to build relationships and collaborate with each other. So this concept of community, and this is where the challenging part comes in, is that this means that community is no longer a geographical location. It's not a village. it's the communities that we're born into that determine our self-identity and our value system. It's the communities in which we're educated in the school systems. It's the communities in which we are educated in terms of profession. It's the organizational communities that we work in within our institutions and in and the communities that are in our neighborhoods. So then this concept of community actually becomes more dynamic. And that if we look at healthcare providers and those who use services, they actually belong to multiple communities all at the same time that are alive And depending on the relationship and how aware they are of how these communities influence the relationships that they have with different people, it means that we can address issues of rights, issues of gender, through the very relationships that give rise to bias and discrimination. And so I think this concept of relationality becomes really important. We know that there's a crisis in disconnect. We know that the FIG global surveys around loneliness and isolation is increasing. We know that communities in many parts of the world have faced conflict, both conflict internally in terms of conflict within families, within communities, but also between nations. And so this social, our experiences of being in relationship with each other is more challenged now than it ever has been. And so community and connection becomes even more important as a solution to the growing polarization that we're seeing in the world.
Thank you.
So there's a paradigm shift that needs to happen within healthcare from a transactional model to a relational model. And I think we need to stop treating community engagement like a checkbox. Community engagement that is kind of extractive and transactional means we go into communities, do a survey, we take data, and then we never come back to the communities. There's no partnership or power sharing. But for partnership and power sharing to happen, it means that the health and care workforce have to be supported in a different way of working. They have to be given legitimacy and authorization and permission to be able to shift the way that they work into a more relational model. And I think this is where social work really comes in, because I think that there's a central argument that the policy report is making is that if we look at the science of human connection and engagement and the practice of community engagement, relationality, it's its foundation. And then when we look at relationality, we need to sort of look at the quality of relationships and the dynamics of interaction within the healthcare system and between the healthcare system and the stakeholders that work in it and out of it. Fundamentally, I think the report says that change must be led by people. And I think this is a powerful message in the report, that change is not directed at people, but it's for people and led by people. And this means that we look at the ecosystem of stakeholders, from social workers to nurses, health promoters, physicians, policymakers, researchers, civil society organizations. Everyone has a role to play in understanding what kind of change needs to happen within our systems and being able to collaborate together to change that.
Yeah, Mercy, I'm sorry. We're coming more or less to an end. It's, if you can wrap up, I'd love to continue listening.
I can wrap it up, Priska. So I think part of what we within WHO are doing is really sort of reimagining the concept of the relationship between health systems and communities. And we're looking at the connection between the people who work in the system, the people who are recipients of the services that the systems provide, and the stakeholders who need to rebuild or reimagine systems that actually work towards well-being and not just treating disease. I think that this is something that social workers have always known, that care is relational, that healing requires trust, and that real systems change doesn't begin with policies, but it begins with people showing up differently. And I think that we should see ourselves as being rebuilders of systems, and that relationships are the foundation for building more humane systems that actually contribute to the health outcomes of those who work in the system and those who are outside of the system. Thanks.
Thank you so much, Asia. That was an amazing link from health and to social work. And I see that with pleasure that we have this collaboration and combining health and relation aspects, that social work and health professionals, and even there we also have to increase our collaboration. And I would now just perfectly pass the word back to Joachim, who is a social work practitioner as well. And you have prepared some slides, Joachim. Hope you're somewhere preparing it. I cannot really see you right now. But Joachim, when you hear all those presentations from the UN agencies, I wonder what that means for you with the IFSW lens and a social work practitioner lens. Somehow appears as he has had some problem with the internet before, and I'm not really seeing him. So I'm asking Annalisa, my colleague, whether she can find Joachim. But until then, I think I raise a question that we have prepared for our dear colleagues here. So we start a bit the discussion and wait for Joachim to be back. And so open somehow a bit the floor for the presenting UN agencies, and wonder, what are the key challenges in achieving a shared vision of care and support systems among different actors. And in your organization, have a civil society organization been actively involved in co-developing strategies, policies, and frameworks? So those two questions, and I think as Laura has been pausing for a while, I would like to give you first the floor, and then give Asako and Asiya the floor. So Laura.
Thank you very much. I think the experience, for instance, that we can bring from ILO supporting decent work for care workers has been the value of the fundamental principles, rights at work related to freedom of association and collective bargaining in advancing decent work. And this, I think, is that something that also in the context of social work and in general for care workers is an aspect that I think it's worth underlining, and also would like to hear examples of success. For instance, we have recently seen community care workers and health workers organizing in Pakistan, forming a union, and so being able to sit at the table, having the power of first of all getting their work recognized as work, as their working conditions, including paying, being valued, and being even increased. So this, I think, it has been for the case of also domestic workers and other important categories of workers that are undervalued and forgotten. In the case of migrant workers, I think it's essential to really underline the value of coming together. And I think using the organization and the power of also initiatives like this to reinforce the capacity networks to influence decision making that concerns those who provide care. So I'd like to pass it to you. Thank you.
Thank you. Thank you so much. And Asako, sorry, I saw that Joachim is back. And Joachim, you have now the floor. I know that you have presented, that you have a presentation. Let's see if it works with sharing the screen. You are the one that can not only link.
Yeah, so thank you so much for being patient with me. I've been having challenges. I hope this will not be. Okay, so. Yeah, so thank you so much, colleagues, and I feel really privileged to engage in this very interesting conversation. And it's really the conversation that triggers my heart because most times I find myself at a place where the rubber hits the road. And so I do both community work. So I'm a practitioner full time, but I also do teach. So I usually, use my practice experiences to share with my students. And I think just to talk about the role of the vital role of social workers in care and support. So, social workers serve as facilitators, and I usually emphasize that we are facilitators. We are not there to impose solutions. We are not there, to take, to the communities, solutions to the problems, but we're there as facilitators, ensuring that individuals, families, and communities access care and support systems. Of course, there could be care and support systems that are available within the communities. There could be care and support systems that, of course, organizations or the government provides at community level, but community members may not be aware about them. But also, of course, the resource that is within the community, that is, tapping into, the resources that communities already have. So those are some of the things that we are supposed to be doing, or we are doing as social workers. So social workers bridge gaps between policy and practice, advocating for equitable services. And again, this draws me back to the, to the concept of Ubuntu. I am because we are, which basically emphasizes collective responsibility in care systems. And so as social workers, these are some of, the low-hanging fruits that we need to take advantage of to provide support and strengthen, already established systems in communities, especially in Africa. And then we have an African proverb which says, the child who is not embraced by the village will burn it down to feel its warmth. A child who is not embraced by the village will burn it down to feel its warmth. Colleagues, this highlights the importance of inclusive care and support to prevent social disintegration. Because when children feel like they are not part and parcel of what is happening at community level or in their households, if they don't feel supported and cared for, there are high chances that these children may, become delinquent and become a social misfit in their, in the, households or families. And so maybe just to, reflect on how I would define what care and support is. I would say, of course, care and support, here we're talking about networks of formal and informal support that enhance well-being, dignity, and resilience. And these networks exist, they're there in the communities. And the only thing that we ought to do as social workers, and what we do as social workers is to reactivate, those networks, whether formal or informal, to be able to respond to the needs of those that need care and support at community level. And of course, we talk about, the key components that, are involved when we're talking about care and support. Currently in Africa and in Zambia in particular, we talk so much about community-based care. And, in 2016, the Zambian government actually launched what was called the childcare reforms. And with that childcare reforms, the aspiration was to ensure that children that were living in childcare facilities were supposed to be removed and reintegrated with the families, either extended families or within the community. And because there was a realization that children would grow better cognitively and even physically when they are with their families or when they are in the communities and not in childcare facilities or institutions. So the concept of community-based care becomes, very paramount. There was also, the time that we used to talk about, a lot of issues about HIV and, in HIV programming, we used to emphasize the aspect of community-based care for, people that are living with HIV. And so, these, care systems and support systems are, very important. With talking about people living with HIV, with in communities as social workers, we also provided support to, establish what we called, support groups. And these support groups would be people living with HIV, but supporting each other. Again, that is another, dimension of care and support, And so why social workers should be concerned? Yes, because social workers, they do assess the needs. Social workers do mediate, and social workers do advocate and also ensure that there is accessibility to, services. They also empower individuals and communities rather than creating a dependency syndrome. So that is also very important. The aspect of empowerment and the aspect of ensuring that, community members are self-reliant and that they are not, developing a dependence syndrome. Again, when we talk about Africa, care and support is looked at as, a collective responsibility. And this is deeply, ingrained in the cultural norms, our norms as the African people. And again, that's where you see the reflection of Ubuntu, the reflection of some of the sayings which say a child does not belong to a family only, a child belongs to the community, and that a child looks at everyone in the community as long as they are older than them, they treat them as uncle or they would treat them as auntie or mom. So this is, these are the values that we try and promote to ensure that there is sustained care and support, for children, but of course, tapping into what is already within the community, the resource that is within the community. Okay. And so, of course, examples of community-driven care, we will talk about care for, elders caring for younger generations. We're talking about extended families supporting orphans or, children without, parents. We're talking about traditional healing integrated with social services. And I think that is quite, very important. And social workers try as much as possible to balance, tradition with modern policies to enhance, effectiveness in, care and support. And so that is really important. And it is really interesting, like this year, you can see in my background, we have our World Social Work Day poster for 2025. And, the theme really resonates with the conversation that we are having now. And we're talking about intergenerational solidarity, and which, of course, tries to, help us reflect on the care that is, passed on from the, older generation, the wisdom, and also the fact that even the older generation ought, to tap into the wisdom of the younger generation. So here, what is key is collaboration between the youths, collaboration with the adults, as well as the elders to strengthen societal well-being. And I think that's quite, important. So preserves, this also ensures that we preserve traditional knowledge while addressing modern challenges. I just want to also reflect on some of the work that my national association here in Zambia is doing, collaborating with UNICEF. and also working with the government of the Republic of Zambia. So as our national association, we've collaborated with UNICEF and the government, and we've deployed social workers who've been seconded to the Department of Social Welfare in the districts. And these, we're talking about remote districts. And they're there to provide support in terms of, supporting the district staff who are usually and oftentimes, understaffed. And these social workers that have been deployed are working to support community volunteers that the government is working with at, at community level. And these volunteers are basically there filling the gap that, social workers should have filled had they been at community level, because trained social workers are only ending at the district level, and they are not, on the ground where the rubber hits the road. And so these community volunteers are trained in what we call community case management. And they work to support families at household level to identify vulnerable households, vulnerable children, and, do the assessments and link them, to services that are available either within their community or even at district level. And that is also in an effort actually to, enhance, the care and support at that level. And so we've seen that children have been, with learning disabilities being supported using family-based interventions. We also see the provision of psychosocial support and also advocacy, as well as linking them to education services. We've also seen that children who were not registered at birth, we're talking about birth registration for children, all those children have been linked to get, to be registered. And so these community volunteers who are our foot soldiers are really playing a critical role to ensure that, care and support is provided, and that, vulnerable children and households have access, to these services. So, of course, key lessons that community inclusion improves sustainability. I think one of the speakers alluded to that we got to ensure that communities themselves participate in whatever, interventions are being, implemented. And because that, of course, improves sustainability. And other than that, we're also talking about early intervention, that it ensures better and long-term outcomes. And also, we also talking about multi-sectoral, stakeholder collaboration, at community level as well as district level, where services are needed. That is, key, because it also enhances and facilitates linkages as well as, collaboration. So here we also see that social workers wear multiple hats to facilitate support systems. One of the hats that social workers wear is that of need analyst. So they're there to, identify needs at, community level or at household level, and also identify gaps as in services that, should have been there to be provided to the needy, families or communities. And we also see that social workers play a role of a mediator, that is, being there as a bridge, between families, institutions, and government, including, organizations. Of course, we're talking about institutions that provide services, at community level. And yes, we also talked earlier about being a facilitator, as in creating safe environments for care. And so I think that's quite important. Then we also, social workers are also motivators. They encourage participation and empowerment. And empowerment, we continuously talk about empowerment and participation, because nothing without community members, nothing without families I mean, nothing should be done with families without their participation. So there is a slogan actually in HIV programming which says nothing about us without us. And so for me, that is quite key. And we also see social workers playing a role of rehabilitator, advocate, as well as a care planner. And so for me, that is quite important. And, with the work that we've been doing with, the ministry, we've also learned a lot of lessons, being on the ground. We found that there's some of the households or some of the families, they hide children with disabilities, so they don't expose them to the public. And these children are hidden in homes, and these community members are the same people that identify these children, and they engage their families, and they are able even to bring out these children from these households who are otherwise hidden, for them to be able to access services. They do a lot of awareness raising in households. They do a lot of engagement at community level, so that some of these issues are not perpetrated. But of course, care and support comes care and support systems come with their own challenges. And I think one of the critical challenges is limited in terms of resources. And most of these are usually, underfunded. And we're also talking about cultural stigma around disabilities and mental health. As I already alluded to, you find children with disabilities are hidden, even persons with, mental health issues are hidden. And even when somebody is going through things, they are going through some mental health challenges, they don't want to come out. And so there's stigma even around all these things. And you find that limits them to accessing care and support. And of course, the challenge in terms of policy practice gaps, which of course limits, effectiveness in terms of care and support. But of course, now with technology, of course, there are opportunities, and I think these are some of the issues that we will be talking about. We also could highlight the aspect of community-based solutions to reduce institutional dependency. Of course, solutions are there in communities where families are, and we only need to reactivate their thought process as facilitators, so that they realize that actually they are sitting where the solutions are, and that they are the solution themselves. And so, of course, the other opportunity are the synergies and stronger partnerships that are being created amongst different players, governments, NGOs, and also traditional leaders. We talk more about traditional leaders in the global south, that they play a key role in terms of care and support. So in terms of way forward, I know that maybe I'm running
yeah, I think we should somehow come a bit to an end.
Yeah, I think I'm concluding. In terms of the way forward, I think we got to look at how do we embed intergenerational approaches into policy and practice, and how do we expand advocacy for inclusive care policies, enhance training for social workers on emerging needs, encourage collaboration between social workers, governments, and local communities. I think that is key. And so in conclusion, this is just a call to action that care and support systems must be holistic, inclusive, and community-driven, and that social workers are change agents, ensuring equitable care for all. And also, I leave you with another African proverb which says, sticks in a bundle are unbreakable. So in this case, we are saying together we can strengthen care and support systems. And so let us commit to building a future where care is a right and not a privilege. So I thank you.
Thank you so much, Joachim. What a wonderful presentation, linking the global attempts and documentation policy paper to practice, and linking that also with IFSW understanding. Amazing to have you as a president and a social work practitioner who can really link the global and the local perspective so well. Thank you so much.